This is an exclusive report by Yusuf Taylor of Gynako Online News. We visited Sanchaba Sulajobe Lower Basic School on 12 February 2022, where we caught up with the CEO of Gender Focused CSO Fantanka during their first health fair.
Fantanka came about because I did research that was focused on parent-child communication, and I realized it is a gap for people who have daughters, particularly, to be able to communicate with their children about sexual health matters. So sex is a taboo in the country. People don't talk about it. That was the reason, one of the reasons why I decided to work on Fantanka. So Fantanka, basically promotes and encourages young people to be able to talk about sexual health matters openly and to be able to take measures that will help them become better women. Basically, we are trying to encourage access to sexual and reproductive health services. So to do that, it is important to get people to have access to contraceptives, have access to information that will help them have sexual and reproductive health. And to do that, it is also important to get women to know their status, to understand whether or not they have COVID, to understand more about COVID, to understand the effects of FGM in our communities, to understand family planning, and also blood sugar testing, because this community they talked about gaps in or difficulties in trying to access services. So it is for this reason why we decided to come to Sanchaba to be able to offer services. So this we have done in collaboration with Malaria Pharmacy, and we have support from Gambia Family Planning Association and Ministry of Health. They have been very supportive in this. Without them, this could not have worked.
Towards the end of the health fair, 3 of the Gynako staff present undertook all the tests and received negative results for COVID and malaria. All 3 registered normal heart rate and blood pressure levels.
We wanted to start somewhere. Where the community itself needed it. So when we talked about it, it was group. We had a discussion, and one of them was like, Sanchaba Sulajobe would be very happy. People of Sanchaba Sulajobe would be very happy if you guys can come here, because access to services can be very limited, and with gender issues, it's hard to kind of go to hospitals in the morning. So can we also have it in the afternoon? Although many people would like it is better to have health fairs in the morning, but some of the reasons basically led us to doing it in the afternoon.
Before leaving, our inquiries revealed that out of the 78 people who were tested, 3 tested positive for COVID-19, including 1 very faint positive COVID-19 test result. They were all provided face masks, sanitizers, and advised to self-isolate and seek medical attention. 1 person also tested positive for malaria, and the patient was given $300 for anti-malaria drugs.
In the future, we are targeting Bakau, we are targeting Chechestown, so we are targeting hard-to-reach communities, not necessarily the communities that can afford it. We might go to places around Senegambia, but the aim of that is for people around Senegambia, inside Senegambia, who are not as fortunate as the other people, to be able to access services as well. I would like to say thank you. I am really impressed by the turnout here, and the team. We have got a very strong team. I am impressed. For the first time, I was just expecting about 10, 15, 20 people, but to have this massive crowd, it is amazing.